Thank you and welcome to our second edition of our vlogging here at Miracle Hills. Today we're going to be talking about a topic that is oftentimes confusing for pet parents to understand, and that is, what is a dental cleaning considered? We're going to utilize the assistance of the guidelines set forth by the American Animal Hospital Association in 2013. They set forth 7 essential steps of a periodontal, what we call a periodontal cleaning here. They'll refer to it as a professional dental cleaning. And the American Animal Hospital Association is the nationally recognized organization for companion animal practices, and the guidelines that they set forth are ones that we follow here at Miracle Hills. So the steps over on the board that we see are, number 1 is going to be a thorough oral exam. 2 will be radiographs of the entire mouth. 3, scaling of the teeth. 4, polishing of the teeth. Next will be subgingival irrigation and evaluation. Next will be applying the sealant. And then lastly, the oral home care instructions that we send home with each pet that we work on. So our first step is going to be the oral evaluation. We talked about that to some degree in the flip the lip session, which was last time. I won't spend a whole lot of time talking about that, except to say that when the mouth is evaluated, there's a couple things that we do here that I didn't talk about last time. One is we do incorporate the use of surgical loops to look at these teeth. The loops do afford me the opportunity to look at each tooth a lot closer than I can with just the naked eye, and in an effort to try to determine if there's any problems with the mouth, whether it be teeth or any masses, any irritation areas, etc. The other thing that we'll oftentimes do is we will use the Aura strips. These Aura strips came out a year or so ago, and we use these in an effort to determine if there is periodontal disease within the mouth of your pet. If there is, this will give us some idea as to the severity of the periodontal disease, which will help to lend credence to the importance of getting them in for a periodontal cleaning. Our next step is going to be to do all of our pre-anesthetic work with regard to blood work, chest x-rays, listening to the chest, heart, lungs, etc., making sure the animal is in good shape and can proceed through the anesthetic period without any problems. Once they are anesthetized, we put an IV catheter in them. They are hooked up to our IV pump, and IV fluids are then administered to them. They're also put on a patient warming system, which is here in front of me, and the patient warming system helps to maintain their body temperature at a safe range. After that is done, then we will proceed to the next step from AHA, and that is the radiographs of the entire mouth. I think this is a very important part of the dental cleaning procedure or periodontal cleaning procedure. It involves the use of these plates. These plates are very similar to the plates that your dentist uses on us for bite wings and other intraoral radiographs. They come in different sizes. We also use a instrument called the Nomad to generate the radiation that's needed to project the image onto these plates. They're then produced through our reader, and as we see over here, this is what we end up getting. There's roughly 15 or so images that we take of the mouth to evaluate each tooth in and of itself. While I am looking at those images, the technicians then will proceed to clean the teeth. They'll use an ultrasonic scaler. The ultrasonic scaler has a couple different attachments. It allows for us to clean both above the gum line or supragingivally, and also below the gum line or subgingivally, to remove all calculus and tartar that may be present. Subsequent to cleaning the teeth, the technicians will then polish the teeth, and they'll polish the teeth using a Profi cup. Looks very similar to this, similar to what they use on us when we get our teeth cleaned, on a slow speed handpiece. That's used in conjunction with some paste that helps to smooth the tooth out so we have a nice, smooth, clean tooth structure. After the girls have polished the teeth, we then will irrigate them, cleaning out all the little pockets underneath the gum line. Those pockets typically are 1 to 2 millimeters in depth, depending upon dogs or cats. And then I will come back in and evaluate the entire mouth, tooth by tooth, looking for any evidence of periodontal pockets, any evidence of any intraoral lesions, such as any masses at that time. Once that's been done, I will then formulate a treatment plan. That treatment plan is communicated to the owner. Once permission has been received by the owner to proceed, we will then do whatever is necessary in the area of periodontal therapy to get that animal's mouth as healthy and back to normal as possible. The last step is going to be to apply a sealant. There's a couple different sealants that are on the market. One is called Oravet, which is what we're currently using. The second one is called Sanos, which is one that we're probably going to be switching to in the near future. These sealants are designed to help reduce plaque buildup on the teeth subsequent to a periodontal cleaning. After that's done, the patient is woken up, monitored, and the owner is called. When the owner comes to pick their pet up at the end of the day, we do go over some four-part, which I mentioned again in the Flip the Lip vlog, a four-part or four-step program for oral home care. Those pets are brought back at 2 weeks after we clean the teeth, and I'll look at the mouth, make sure everything's healed up properly, and then they're brought in every 3 months at no additional charge to make sure that we're doing a good job keeping those teeth nice and clean. Should you have any questions with regard to this vlog, please feel free to call us at Miracle Hills Animal Hospital, 402-492-9022, and I'll be more than happy to answer any questions that you may have. Thank you for watching.